talk a little bit more about workforce, as that's one of the bigger challenges. And I think, we talked about people are stretched completely thin. Recruitment is hard, as which we talked about earlier. And how do we now use telemedicine to help extend and support everybody rather than, the opposite?
Yeah, that's a super important conversation to have, because, the first thing that a lot of people think about is replacing.
Yeah, absolutely.
I'm going to do a telemedicine partnership, and that'll replace, and I won't need ABC or whatever, whoever. And that's 180% from the truth.
Yeah.
We are a support system. We provide, that's the whole premise that this organization was built on. But yeah, you're right. There's just not enough people to take care of the people, especially in rural America.
Yeah.
And if you look across the different services that we provide, it's even more exacerbated, especially, I'll just use behavioral health for an example. There's nowhere that I go around the country, even this week, earlier this week when I was, everybody wants to talk about, behavioral health services. We're super blessed to have a pretty robust team supporting some of the smallest and some of the largest, smallest community hospitals, the largest tertiary quaternary medical centers in the United States, supporting cities, counties, states, across the care continuum, and that team's absolutely amazing.
Yeah.
Recently, I was having a discussion with a policymaker about crisis care.
Yeah.
And it was in a higher populated state, and there was some concern about workforce, our workforce being able to have enough people to care for their people.
Okay, yeah.
And I gave the example. And we had recently an opening. We had a job posted for a couple of behavioral health nurses to support our crisis care service line. And over the period of a week, we had almost 500 applications for those two jobs.
Yeah.
I mean, that was pretty telling. And is there risk? Does that, there's also that takes somebody away from a potential bedside job, but it also kind of speaks to the attractiveness of, being a part of the Avel team and being able to take the knowledge, skills, and clinical capabilities of those individuals and spread it out to an even bigger population. So, yeah, workforce is a big topic of conversation.
Yeah. I kind of want to dive a little bit more, too, about the extension of becoming part of their team and what that means, because I feel like sometimes when we have had an encounter, we have a lot of off-putting people that are like, you're going to capture everything I'm doing and you're going to tell me what I'm doing wrong, or you're going to be my big brother and I don't want you to be my big brother. So what is that? When we say we're an extension of your team, what does that really mean?
Yeah, that's, a couple of things.
Yeah.
First of all, and as I explain it to a lot of folks in the government space or even in the hospital space, our providers become your providers. It's
Absolutely.
that simple.
Yep.
They become part of your team, licensed, credentialed, privileged in your facility, regardless of whether it's a federal, state, irrespective of that. And so that helps.
Yeah.
But also, we've got a phenomenal implementation process, but even better implementation team. And one of the key elements of that whole implementation process is change management. And, across our organization, helping those local partners to, because we've been doing it for so long across so many, we've got so much experiential knowledge out there to help those local champions that saw fit to have a partnership with us and to take those learnings and really help get those services implemented in that local community.
Absolutely.